Okay, let's talk about chapter 22, surgical asepsis. You ready for it? Okay, we're going to talk about we want a sterile field, so without any bacteria or pathogens. Okay, disinfection versus sterilization. Disinfection kills most of the pathogens. It's what we consider bloodborne pathogens and growth of organisms that cause infection. Sterilization means that we kill all of the bloodborne pathogens. We use steam under pressure, gas, or radiation to kill all pathogens and their spores. Okay, there's different types of sterilization. We can do autoclaving, which delivers steam under pressure with heat ranging from 250 degrees Celsius, or Fahrenheit, sorry, to 270 degrees Fahrenheit. We can boil, which is we boil instruments and supplies in water for 10 minutes and we kill all the non-spore forming organisms, but does not kill the spores. And ionizing radiation kills bacteria on sutures, some plastics, and biological materials that cannot be boiled or autoclaved. We also have disinfection, which kills pathogens on equipment and supplies that cannot be heated. And that could be for various reasons. Maybe it's too big, like a bed can be disinfected. And then gaseous infection kills pathogens on supplies and equipment that are heat sensitive or must remain dry. So we would do stuff that possibly like plastics that could melt, but or any kind of instrument that if we heated them up, they would not be able to work after that. Sterility, we're talking about suture or instruments. We often double wrap them. So the outside wrap is going to be the surface, okay? And everything on top of that surface would be sterile. So surgical instruments are often double wrapped, okay? After wrapping, the instruments are sterilized in an autoclave. Um, Indicating tape, we put sterile on the outside of the flaps, okay? And once the pack has been sterilized in autoclave, the indicator tape shows black marks every half inch, okay? So that wrap, that tape verifies there's no contamination and there's a water indicator. And if it gets any kind of fluid on it, it discolors that line, okay? We also have expiration dates on packages like that. We don't want to use any kind of tools that are past the expiration date. Okay, sterile settings. Usually you will see restricted access to these parts because they're sterile settings, and so anything going past needs to um, go through a process to make sure that we as sterile as we can get it. Okay, so surgical suites, heart catheterization laboratories, delivery rooms, neonatal intensive care, burn units. Think about burn units that first defense of the skin is broken, so they're very susceptible to any kind of infection. Transplantation intensive care units. When a person gets a new heart, says let's say heart, we basically we decrease their immunization to things, their immunity to things, so it doesn't reject that heart. Oncology units, when we're doing chemotherapy, we kill the good cells and the bad cells. So they're going to be, I've had patients that had the white count of 0. Okay, they just don't have any immunity whatsoever. And so what we call that is reverse isolation. We're keeping when we go in there, we have a mask on. We don't allow like fresh fruit. We don't allow flowers, anything that could possibly carry any kind of pathogen into the patient. And there's other settings other than this. Um, Sometimes we can't sterilize the whole unit. Okay, so like when we're talking about even delivery rooms, we don't use outside um, the OB nurses don't use their own scrubs. They use scrubs that were cleaned at the hospital. They might have shoe covers on. lab coats if they go off the unit, okay, or go into isolation. Um, and then we also have hair nets, okay, just to keep everything as sterile as we possibly can. Principles of sterile techniques. Contamination is the potential to a presence of a pathogen on a sterile object or field. When we talk about sterile field, it's an area that is free of all microorganisms, um, and that's where the sterile items will be placed. And when we're talking about sterile conscience, that's always being aware and taking action to prevent contamination. And that's even being like that person that lets somebody know that they broke sterile field. Okay, guidelines for using sterile techniques. Remember, sterile plus sterile equals sterile. Sterile plus unsterile equals contaminated, and unsterile plus unsterile is contaminated. So two negatives do not make a positive in this aspect. Opening sterile supplies, we must check the expiration date. I know times where surgeries have been delayed because of not utensils, that's just an awful way of saying utensil. Um, but the um, tools that they would use are out of date, so they had to go and get more. Um, we're going to check the sterilization tape if present for any color change. So if there's any color change, that means that was wet. So we don't want to use that. And check for packaging for any holes or tears, because that could show that it's been contaminated. Okay, setting up the sterile field. We're going to set up the sterile field. The outer 1 inch of the sterile drape is considered contaminated. Anything below the surface of the drape table is considered unsterile. So you have your sterile field maybe on a bedside table. Anything below the bedside table is considered contaminated. All parts of the sterile drape below the table is considered unsterile. So if it's hanging off the table, it's unsterile. Only sterile items can be placed on a sterile field. Okay, so if you open up a package and because you touched it, maybe on the outside of it, it's no longer sterile and you can't put it back in the sterile field. And if the sterile field becomes damp or wet, it's no longer a sterile field. And that means for anything. If you are putting in, say, the sterile normal saline for a catheter and you accidentally put some water out, that is no longer sterile field. Okay. Okay. Adding items to the sterile field. So add sterile items to the field by opening peel apart packs and dropping them onto the field. And we're going to show you that in lab what that looks like. Add sterile liquids to a basin is a sterile field by holding the bottle so that the label is against the palm of your hand. Okay, and we can pour it into a container that way. Hold the bottle approximately 4 to 6 inches above the basin and only touch sterile field while donning sterile gloves. So if you have clean gloves and touch the sterile field, it's no longer sterile. Only sterile gloved hands can touch the sterile field. Okay, opening sterile packs. Set the sterile pack on the clean surface position so that the first flap will open away from you. All this stuff we'll be showing you in lab. Okay, open the flap that folds away from you first and then open each of the side flaps. So you want to go away from you first because you're not going to be able to see under that. Okay, to make sure that it stays sterile. Open the flap that folds towards you last because you see that last flap. Okay, working for use the guidelines for using sterile field continue. Number 4. Do not reach across the sterile field unless you are wearing sterile gown or gloves. It's kind of like you don't go past. I always think of football. Just as long as you go across the plane of the touchdown area, you get a touchdown. So we don't want to go across that plane if we don't have sterile gown and gloves on. Keep the sterile field in view at all times. If you turn your back onto from a sterile field, it's no longer sterile. So you always have to, it always has to be in front of you. Keep your gloved hands in the safety zone. And when sterile objects are exposed to air for a long period of time, they are no longer considered sterile. We don't know what happens. Okay? When to use a sterile technique? When entering a sterile body cavity with a tube or invasive equipment like a catheter insertion, Foley catheter, IV insertion should be as sterile as we can get it, and med injections should be as sterile as we can get it. When caring for patients whose skin is not intact, so burns, open wounds, like skin tears, anything that gets the skin open, okay? During procedures that expose body cavities or enter major vessels, so surgery, heart caths, deliveries, we should be as sterile as we can get it. And when handling needles, syringes, and lancets, okay, we have to be careful. Okay, we want to keep those instruments sterile also. Entering the operating room, before entering the surgical suite, you're going to do a surgical hand scrub, which is very thorough. You're going to put on your scrubs, and that would be the operating room scrubs. You don't wear your own scrubs. Okay, operating room and delivery, they change at the hospital. You're going to have shoe covers on, head cover, and you're going to have a mask and a sterile gown. So if you're going to be near the patient during the operation, you're going to be wearing a sterile gown. So even say you went to the cafeteria, wore a white coat to protect your scrubs, and you come back, we're still going to put a sterile gown on you because we want to make it aseptic as possible. Okay, assistance of the surgical team, like a scrub nurse. The scrub nurse helps with the patient. Okay. Circulating nurse. The circulating nurse is basically the advocate for the patient or the patient navigator. So she makes sure everybody's doing their job, making sure everything's set up. And her whole goal is that that patient go into surgery and out of surgery safely. And then we have surgical technologists, and what their job is to help the doctor. So the doctor calls for I don't know why I want to keep on saying utensils. If they're calling for a scalpel or any kind of equipment, that surgical technologist is the one that hands it to him. Okay, now, told you it was short and sweet. This method of sterilization kills pathogens on sutures, some plastics, and then biological materials that can't be boiled or autoclaved. And the answer is ionizing radiation. Whoop, whoop. Did you get that one right? Okay, next one. Clicker question. Which of the following is an example of a sterilization? Wiping down IV pools with Clorox wipes, autoclaving, using hand sanitizer, or washing instruments in soapy water. And the answer is autoclaving. Okay, you guys are going to need to know this, the information on how to keep it sterile, especially when you're talking about turning your back or anything below the sterile field. If the sterile field's wet or whatnot, you need to know that. Okay, but we'll talk about that more in class or lab. Thank you very much and have a wonderful day. Bye.